So another question that I get all the time is people understanding pain? When it's actually like, when is it okay to push and when should I pull back? So tell me a little bit about, like, conversations that you've had with your patients, or, what we can tell our audience.
Yeah. Well, I know for me, I like to think of pain as a sign that something is going on in your body. So I don't like to ignore signs. I know we want to just push it away and let it not be a thing, especially when it's that little low grade ache. But it's usually us telling us something we need to start to pay attention to, or just like start to be a little more aware of. So I know with my patients, I try to talk about, there's a certain amount of pain that we can kind of push through, and that we're gonna put it on a scale of 0 to 10, which I know everyone's heard. But if we're in that lower range of like 2 to 3 out of 10, usually I'm okay with a little bit of that uncomfortable. It's a little bit like just kind of manageable, but you can still do what we're asking. You're not modifying your movements. But now when the patients are starting to get up into that like 5 out of 6 out of 10, or, they're like sore for 3 days, that's always giving me that little sign to be like, oh, we've done a little too much, or we need to back off, because the body's now giving us more of those signals, more of those signs to say we got to kind of like do less because we're overloading or overdoing the system.
Yeah, absolutely. And then like kind of quality of pain, I tell people, like, if it's sharp and stabbing, right, then, versus, okay, hey, something kind of feels, sore, that is different. So kind of the quality of the pain as well. But yeah, I mean, I think that those are great ways, because as people get better, and they load that tissue, it is going to feel sore. And so it's normal. So we don't want to inhibit people from moving forward and pushing their body a little bit, but just kind of knowing red light, green light.
Right. Yeah, I think it's the biggest thing is kind of knowing how we can push and keep working without the overdoing component, which I know we all just want to jump right to that end point. So taking our time and listening to, again, what our body's kind of guiding us and telling us is most important.
Yeah, and I think as they're returning to activity, come back and talk to us. I always encourage, my patients to be like, hey, if there were certain activities you're like, hey, I'm really kind of trying to push through, and that's when I start to get the pain. Okay, well then, we have some other work to do so we can improve on, whether it be endurance or some sport specific, strategies or whatnot, so they can push themselves and return.